And aside from the physical toll of COVID-19, there's also the emotional toll. Mental health professionals are reporting an increase in cases of depression, anxiety, and loneliness. News specialist Debbie Worthen is covering this for us today. Debbie, how big of an increase are you talking about?
Big. In fact, according to the Kaiser Family Foundation, they report that 20% more people say they're depressed now than they were back in March. So what that means is more than 1 in 2 people say they've suffered from depression, and that is directly linked to living during a pandemic. So last year, from January to June, 11% of Americans reported issues of anxiety or depression disorder. During the last 3 months, those numbers have continued to climb. Reporting in late July of 2020 showed that number had topped 40%.
And I think with my clients, that's something that we're actively working on all the time of we need to bring in these people so you're not alone in this. Because I truly feel like our world is too big to do all by ourselves, and our different roles that we have and the hats that we have to wear. We need our people.
A broad body of research also shows that the elderly and adolescents 12 to 17 years old are suffering the most from social distancing and isolation. And moms with kids have seen a big increase in general stress. More than a third of adults are also reporting specific negative impacts on their mental health and well-being, such as a tough time sleeping or eating. There's a reported 12% increase in alcohol consumption or substance abuse and worsening chronic condition due to worry and stress over the coronavirus. Now, the Coronavirus Aid, Relief, and Economic Securities Act, so the CARES Act, actually has money allocated for mental health help. In fact, $425 million across the country, and a lot of that is available here in Utah as well. Back to you.
Well, those are serious signs too, Debbie. Thank you. Stay with KSL as we continue to follow these impacts of the virus on everything in Utah, from our education to our economy and our health, and of course the daily case count that impacts all of us.